quite get the reading the first time because I didn't release my bulb, in a normal situation, I would wait 1 full minute or I would switch arms. But because this is a test, may I take you right back up?
Absolutely.
In case that happens to you. (118/64). If my client had high blood pressure, there's several positions that I do want to avoid. I don't want them to ever have the head lower than the heart, so no declines. I want to make sure that I vary their overhead movement so it doesn't exasperate their blood pressure. I want them to have a loose grip, not tight. They will not do the Valsalva maneuver, which is holding their breath. And I want to make sure that they breathe consistently while they're doing exercises. Isometrics aren't recommended for them, especially for a sustained period of time. If I have a client who has blood pressure problems, if they're on a diuretic, I'm worried about that if they get dehydrated. That's definitely going to affect their blood pressure. If they're on a beta blocker, it's going to slow that down. A calcium channel blocker may or may not have an effect on that blood pressure. It's a very individualized response. During exercise, I expect the blood pressure to be elevated, both the systolic and slightly in the diastolic. But after them working out for a period of time, their body should become much more efficient and their blood pressure should lower. Skin fold measurements is a way for me to tell you what your body fat is. We have this thing called fat versus lean is total body weight. Fat is adipose tissue or subcutaneous fat. Your lean mass is your bone, your hair, your tissue, your eyelashes, your organs. If I add your fat to your lean mass, I get total body weight. There's different ranges of percentage of body fat. Men need an essential of 2 to 4%. 12 to 18% is normal, and if a man is over 25%, they're considered to be obese. Females need a little bit higher because of childbearing. 8 to 12% is essential. 18 to 25 is average, and we're looking at over 30% considers to make a female obese. When we do the skin fold measurements, there's 3 sites specific for men, which are chest, abdominal, and thigh. On another protocol for women, it's tricep, ilium, and thigh. I would like to show you the 7 sides. Body fat is always taken on the right side of the body. We have one here called the subscapularis. I need to find the inferior angle of the bottom of the scapula. I'm going to go 1 to 2 centimeters away from that angle and take it at a diagonal. I'm going to pinch, pull, and separate the muscle from the fat. I will let the calipers rest halfway between that pinch, not letting go, and my number settles. I'll log that down. I now then can go to the tricep, which is between the acromion and the olecranon, and it is midways between that point. I'm going to take this pinch at a vertical. I'm going to pinch, pull, and separate muscle from fat, again letting the calipers rest halfway between that. I now go to the chest. There's a difference between men and women. For men, we will go halfway between the nipple and the axillary line, take it at a diagonal. For females, it is 1/3 of the distance because of the breast tissue. Again, pinch, pull, separate, and let the caliper rest. I now will drop down to the axilla. If I find the axillary line and follow that down, I'll ask the client to press where their xiphoid process is. Where these 2 points intersect is my axilla, and I will pinch this at a vertical. I now drop down from the axillary line, and I ask them to point to that bone on their hip known as the iliac crest. I'll take the suprailium at a diagonal slightly above and forward from that. I now go to the abdominal, which is 1 to 2 centimeters away from the umbilicus, so having them point, watch for belly rings. I'll pinch, pull, and separate, letting that rest. I now will take the quad or the thigh, but I must disengage the muscle. When they're standing, the muscle is engaged, so I need my client to rest the heel over the toe so the muscle's disengaged. It is midways between the hip and the patella or the kneecap. I will take this at a vertical, pinch, pull, and separating the skin. I will add all 7 of those measurements up, and I will come to a chart. I will trace their age and their numbers of total skin folds, and that will tell me their percentage of body fat. When I'm doing circumferential measurements, I'm going to use this thing called a Goulet tape. It is a tension meter tape. The two that I'm required to do for my test are the abdominal, so I will find the umbilicus or the belly button, and I will go around my client so as to keep a nice professional presentation. Have her spin. Now, when I come to the center so they can see, please. When I go here, I'm going to pull this little lever out. When I look close, I can see a red line. At that red line, I'm going to stop. Where my 0 intersects with the number, that is what I'm reporting as their circumferential measurements for the abdominal. The other measurement I will take is the waist. The waist is 2 inches above the umbilicus. So again, I find the belly button, I come up 2 inches, and I now go around. Curtsy. Come center. Again, pull this out till I see my red or blue mark and intersect. Where my 0 meets the number is my reading. Programming. If I have a client who wants to increase their lean muscle mass, then I need to have a series of strength training and aerobics. If I have someone who wants to just put on a lot of muscle, they necessarily don't do a lot of aerobics, they do a lot more heavy lifting. Body fat percentage also has an error of margin of 3.5 plus or minus. I should always take body fat before exercise so there's no distension to the muscles or the tissue.
Very good. I was going to ask you a question about the BMI index. What should it be?
Oh, I forgot to study that.
All right.
That's 11 minutes and 45 seconds. So she's still got plenty of time to take a break, go to the bathroom, go have a snack.
Now you notice
got everything in.
She if the examiner
That's
would
awesome.
have stopped her and asked her questions, which they don't want to do,